Well, hello, everyone. I want to welcome you. I'm Angelique Beslic, and you are in the right place. You're in the Healthcare Supply Chain Hub, where I go through on Tuesdays with healthcare supply chain professionals, and we review hot topics here and this is 30 minutes long. So we do this every Tuesday. So I'm so glad that you're here, and let's go check out what our hot topic is for this week. We are going to review GPO. So if you don't know what that means, group purchasing organization contracts versus local contracts. And when we talk about that, we talk about a local contract, because some people may not be in strategic sourcing and contracting. That is a contract that is on your organization's paper, right? Versus on the GPO's paper. I want to make sure that everyone here understands how making the right choice without leaving value on the table when you're trying to decide, do I go with the GPO's contract or do I go with local? We're going to kind of break this down a little bit so that you're looking at the total value. As you guys know from me, I'm always thinking about total cost of ownership, not just the price at the pump. So this includes that. So I'm excited to kind of jump into this with you guys today. When I think of the problem, when a strategic sourcing and contracting professional is sitting there thinking, do I do this on GPO paper or do I do this locally? Most teams ask which one's cheaper. Now, you guys know if I'm looking at value analysis or how we even vet a product or a service, we're not thinking about what's cheaper. We're using the quadruple aim. So you're thinking about quality, safety, outcomes, right? Satisfaction of your providers and of your patients. You're thinking about cost. Yes, that's only part of the quadruple aim, but you need to think about total cost of ownership and value that you're getting through the contract. So we're going to talk about that a lot today. And high performing teams actually ask which delivers the most total value, not just price at the pump. And so let's kind of dive into all those aspects of each and the things I really want you guys asking when you're trying to decipher from a GPO contract to local. Okay. So some key takeaways and things you guys are going to learn about today is GPO versus local is not a price debate. It's a strategic decision. And what am I always talking about if you guys follow me? Strategy, 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 not transactional. A price debate is very transactional, okay? The wrong default choice quietly destroys value. So if you actually just pick everything based on pricing all the time, I can guarantee that within that contract, whether it's terms and conditions, shipping and handling, or tariff, if you forget to put a tariff clause in there, or termination clause is not accurate, or waste, or all these other terms and conditions, you're not thinking about those things in your mind when you think of total cost of ownership. You're quietly destroying your value. And a 50-cent pen could turn into a $17 pen pretty quickly with depending on the terms and conditions, right? High performing teams really align contract strategy to the overall category, your entire book of business with that vendor, risk, speed to execution, time to execution, people will call it, of how quickly you can get the terms and conditions and the contract fully executed so you're getting the benefits of the contract that you were looking for. Total cost of ownership beats unit price every single time. Because if there are clauses in that contract that you're sitting there going, oh, wow, that adds another percent on top of my contract. Oh, wow. I put a rebate in there, but oops, I forgot to ask for it. And now it's past the statute of limitations. Oops, right? All these things. And then intentional decisions outperform emotional preferences. So if your team emotionally says, well, I always go on the GPO paper. Okay, well, why? Because they're the GPO and we pay them to do something. So I would just assume that they always have the best deal for me. Okay, why? What are they giving you, right? Emotionally is one thing, but what are they giving you value-wise and operationally and clinically and financially as this entire total cost of ownership package? And it sounds to me maybe you're making an assumption, right? So you have to make sure you've got your team really understands in strategic sourcing and contracting and clinical value analysis and your analytics team, right? What's the value you get from your GPO? And how well have you negotiated your GPO contract? Because of what are they giving you? What kind of protection do they give you? Has your legal team said, oh, whenever something comes over on GPO paper, you don't need to run it by legal? Oh, wow, that takes a lot of labor off of my side of the fence because now I don't have to wait 6 weeks for my legal team to review a contract. Wow. Timed execution, speed to benefit, right? All these things add up to total cost of ownership for a contract. So let's just talk real quick about why organizations use GPO contracts. Speed to value, like I just said, sometimes your legal department will even say, hey, if it's on GPO paper and we're very familiar with their legal team and the way they structure their contracts, legal never has to review them here unless there's an amendment or an enhanced addendum of some sort, right? So speed to value. Also, the contract's already negotiated between the GPO and the manufacturer. Speed to value meaning all I got to do is go on my dashboard and activate it, right? Or maybe sign a letter of participation or a letter of commitment, right? Benchmark is already validated the pricing to it. So you already know where you are with your spend, where you benchmark, what tier you already fit into pricing wise, and then you just have to make a decision. Or am I willing to accept that? And then there, of course, there's the scale and the leverage of it, right? You are participating with all those GPOs members in that agreement. So the supplier, the vendor, or the manufacturer came forward to the GPO and said, if you can get 20% of your members, and let's just say there's 4,000 members, to sign up for this contract, we will give you whatever fees. Or if you could get to this much spend in volume, we're leveraging volume of their members. We'll give the GPO X deal, right, on that contract. That's how that works. There's scale and there's leverage. And even you may hear your GPO saying, I need you to sign up for this contract. I need members signed up for this contract because I need to scale and leverage this contract with this manufacturer. It reduces the contracting risk, right? I said it before. If your legal team knows the Vizient legal team and you trust their terms and conditions, you know you're not at risk. But I look at the tariff situation, for example. Did your GPO stick to no tariff rules in their contracts during all that tariff debacle? Ours did. So actually, I had the GPO going back to the manufacturers saying, sorry, the GPO contract says no tariffs. Where was I dealing with tariffs? On all my local contracts? Because I didn't think to have that language in there. Or some of us didn't think to have it, or some had it, some didn't. I was running around, right? So that's where you could reduce risk. And then there's operational discipline. If your team always knows that 65, 85% of your contracts are going to be on GPO paper, you've got a discipline in that. But then your clinical teams know it. Your stakeholder teams know it. They know, oh, it's a GPO contract. I know what the discipline is of it. And then you get into other workflow disciplines like watching for your administrative rebates and your impact standardization rebates and all your admin fees and all these things that come along with it. You have a cadence for that now. But then your operational discipline in how you review it, how you go into your dashboard and activate it, all these things that have to happen, it just becomes a discipline within your team and it becomes easier. Why do organizations go local? And I was going to put a slide in here for hybrid because you could go with a GPO contract. And if the supplier willing, they may allow you to do an enhanced addendum to the GPO contract where it's a one pager, two pager maybe, and it says I am participating in XYZ GPO contract, but I have a couple enhancements to it. Maybe they're going to extend the expiration date on it for you. Maybe they're going to give you a little extra rebate. Maybe they're going to give you a better tier, right? But you don't really qualify it for it on the GPO contract, but they're going to enhance it over here. So there is a hybrid between these two, okay? But why do organizations go local? Maybe there's so much clinical differentiation that you are like, oh my gosh, I'm never going to make that tier. It's just never going to work for me. I can't do the commitment. Here I am, right? And I have got to do, because of all these clinical needs, I have to do a local agreement. It might happen, right? Maybe because of innovation and evaluations you're doing clinically or pilots or things, you just can't do the GPO contract. You've got to do a short-term little contract, or you need to do a contract where you pivot to different products within a shorter amount of period that the GPO just doesn't cover. Hey, maybe there's vendors that just don't work with your GPO and there is no contract, right? Maybe custom terms. If you can't cover it in some kind of a hybrid enhanced addendum, and there's some custom terms, right, that need to be done locally, that could possibly happen as well. Or maybe there's some kind of service level dependency, something that the GPO doesn't have locked in a term, that service level that has to be done on local paper. Maybe I bought a piece of equipment through the GPO contract, but I also now need a service agreement that is not sustained through GPO. Or maybe the outcome variability is too different, and it's something very specific to your healthcare organization. You guys know, as I'm talking about total cost of ownership, we've now been talking about reduction in reimbursement and outcomes variances on the back end of consumption at the patient level, maybe writing in some share back with the vendor into your contracting, right? So value-based contracting, that's called. Maybe you're asking them to share in if CMS or private payers do not reimburse you fully because of something to do with the equipment or something to do with the supply, they share back in that. And that totally is a local operational thing that you've maybe set up with your manufacturer. So there's several different reasons out there, but if you can, maybe see if you can do a hybrid, and some of the vendors will allow for that. So where teams get it wrong when they're trying to do this, and some of this is fed from stakeholders, right? Clinicians or stakeholders around your organization, or even maybe your team. I've seen teams that are like, yeah, we have a GPO, but I don't know what they do, so we just don't talk to them, right? That happens. Some assumed emotional decisions, default behaviors. Maybe it's years and years of the supply chain team just doesn't even know how to work with the GPO, or they don't know what the value of a GPO is, and I don't even know why they're there. They're not even invited to any of our meetings because we don't trust them. They seem like a vendor to us, right? Maybe there's some of that. And maybe the team is just so defaulted on those behaviors that behavior or brand has gotten all the way to the C-suite. And unfortunately, the C-suite's not participating or aligning or supporting a GPO in your organization because maybe they're not educated enough to know what a GPO does for your organization. Of course, we already talked about price only focus, lack of total cost of ownership analysis. It's not just the price at the pump. When you guys do a business case, financial impact statement, trying to figure out what the benefits of the GPO contract are versus a local, I'm hoping that you've got all your financial analysis, list out all your pros and cons, all the benefits, time to execution, all those things. What are some other back end things that they're going to give you? Are you guys doing a side by side modeling of GPO versus local contract? And how are you doing that? And then, of course, if the team doesn't have a category strategy, category management, product categorization, and you're literally just out there contracting for a product at a time, that's even a bigger issue because if you're not managing your supply chain by category management, you need to come to me and we're going to have a whole different conversation. GPOs really do want to be contracting by product category, right? Vizient has their product spend categories. Premier calls them something different. You have to be contracting by product category. I surely hope you're not out there working your spine initiative or your trauma initiative or your wound care initiative or some kind of respiratory supplies category or your CRM category. Hopefully, you're not breaking that apart into pieces and you're actually contracting for the whole category. That's a whole different subject. We should get into at another Learning Byte. All right, so the decision framework that we need, right, to say, I want to choose between the GPO versus a local contract strategy. I have my team talk to our stakeholder team in a kickoff meeting, probably like on the front end. Okay. I don't like to have this conversation right before I'm ready to sign a contract. I like to kick off an initiative, do an RFP, whatever it is, and I like to have this conversation with stakeholders ahead of time. I like them to actually know, hey, the GPO supports this vendor, but they don't have contracts with these vendors. That's a strategy up front when you're talking about your sourcing plan. That is being strategic versus transactional. I think your stakeholders out there really should know which vendors are under GPO contract versus not. Maybe it'll help them in their decision making. Or they might ask you questions like, well, hey, Angelique, why would we want to go with our GPO on this product category versus just do something locally? And you guys can have that intelligent conversation strategically about it, right? Okay, so then we talked about total cost of ownership. You have to have some kind of decision framework around total cost of ownership. It's very, very important. And then risk exposure, contractually, especially. Have you worked with your legal team to say, legal team, is it the C-suite's wish to have everything on local paper? You're gonna need to hire more people, right? In the legal department and in strategic sourcing and contracting department. Or maybe they're like, your team is like, get everything on GPO paper. I don't need any legal team. I don't need strategic sourcing and contracting team that's really super heavy in contracting. It all depends on the risk exposure that your team wants. What is your team strategy? What does your C-suite want as a strategy? And then we talk about having a framework around speed to value. If I go into a kickoff meeting with my stakeholders and I say, hey, we should get this initiative done in 90 days. Let's get it all the way to ink on the paper, right, in 90 days. And the GPO is going to help you get you there faster, or any of your other partners that you work with. You have presentations to be done, evaluations to be done. Who can help you get those things done faster? And if you're partnering with your GPO, they may be able to help, right? And then, of course, it's all about your operational capability. You need to make sure in your decision framework that you have and understand your internal operational capability. And by that, I mean, hey, is our team able to work through a GPO contract faster than a local? Is that going to take more time? Do we have to put together the PowerPoints? Do we have to put together the analytics? Well, if you have your GPO doing that, and they're taking all the resources and capacity to do that for you, Awesome. If you've got 50 FTEs sitting around that can just do all this work that the GPO does, great for you as well. But most of us are going through reductions in force and we are really constrained with our headcount. And we need the GPO to be leaning in more and more with FTEs. All right. So, as you guys know, every single week I give you a massive action checklist. It's usually about a page, page and a half, maybe sometimes 2 pages of a checklist of things that I want you guys to do and go implement tomorrow or this week or next week and go check some things out. I want you guys to be held accountable for helping with change. So my hope is that within your ERP system or your contract management system, maybe you guys use NTRAX or something other than your ERP, inventorying your contracts. Who here has ever just inventoried your contracts and run a report based on how many are GPO, how many are local, what's your percentage of contract, number of contracts, spend, maybe even items attached to that category management. Just run a bunch of reports and understand what does that look like. And your administrative fees and your rebates and all these things that you wanted to get from your relationship from your GPO. How many times do you guys just inventory or run reports on, are you doing what you said you wanted to do? And then who owns each decision? Have you mapped that out? Have you done a RACI between supply chain, your stakeholders, finance, legal, the GPO, and understanding who owns each part of those pieces of the decision and who kind of owns the right part of the process itself as well? I also really struggle a lot between connection of all my sites in my GPO to my hospitals, my acute care facilities, and my non-acute facilities. There's been a lot of times when I do a GPO contract and I forget to hook up all my non-acute locations to that GPO contract, and I'm missing out on admin fees. Like, who's doing that? Have you said that relationship in your GPO contract that you were doing that responsibility or your GPO is doing that? Because I can guarantee you're losing out on money there too, right? So just inventorying all the pieces of your GPO contracting and your local contracting. I want you guys to think about classifying your categories, really determining if strategic or transactional before choosing a path for all your categories. That's why it's important to use a sourcing plan of some sort. And if you guys are taking my certification program, you guys will see that I utilize a sourcing plan for all of my RFPs, really thinking about what's in scope in that product category, what's out of scope. And I don't choose a path until I really understand the scope and requirements of each and every initiative. So making sure that you're doing that and validating your total value, right? Comparing your GPO benchmarks, your local pricing using total cost of ownership, but also not just the price at the pump. We're talking about all the costs on the back end, including to all the way to patient consumption and reimbursement. I want you to start looking at assessing your risk and your capabilities, right? Understanding your supply risk, whether your team can manage the contract long term. We talk about all the time in my certification program. Please do not fully execute a contract, put it in your repository, whether that's in your ERP or NTRAX or contract management system, and forget about it, right? If you're not doing lookbacks, if you're not doing compliance checks, looking at for contractual scope creep, it's all for nothing, right? But are you asking your GPO to help you with that? Are you asking your suppliers to help with that? In my program, I always say suppliers lean in, right? But who's going to manage that from your team, the contract long term? And then aligning to your enterprise priorities. Contract decisions must support some kind of a system strategy, not a site preference. I'm hoping that if you guys work for a health system, the system works as a system, not as a hospital by hospital. And then document and revisit all of your RACEs, processes, contracts intentionally, right? Capturing your rationale, enforcing compliance, reassessing as conditions change. These are all things that are on the checklist. So my last final thoughts for you guys for today. It's not thinking about GPO contract versus local contract. It's intentional strategy versus expensive habits. If you, I look at some health systems out there where their strategy is GPO all the way. Okay, I hope that that strategy works for you, and it may, but I'm hoping that you've assessed local many, many, many times through the year just to make sure. Because if you made that decision 100% to be with your GPO and you are not assessing local throughout the year, you could just be intentionally utilizing expensive habits. And you think about autonomy without discipline is just expensive independence. So I could also say that I want all my contracts on local paper. Well, that could just be expensive independence because if you don't have any discipline around it, and it's the wild, wild west, right? You never know if you're doing the right thing for total cost of ownership of that contract. I could talk about this stuff all day long, and you guys know it. I know many of you have taken my certification programs. I love to talk, and I love to teach on this stuff. But if you guys have any questions, please, please reach out to me. Make sure that you're getting my emails. They're not in your spam folder. But I do like to make sure you guys have my email address, how to get a hold of us on the website, because I'm always here for you and I love to brainstorm stuff. So please reach out to me. I hope that you guys have a wonderful day and I will see you next Tuesday. So thanks for being with me. I appreciate you. Bye, everybody.